All right, so let me share my screen and we'll get going with week 2. Has anybody had a chance to review your week 2 notes? Does anybody know what we're covering today?
Is it the school nurse?
School nurse, yep. What else?
Childhood ailments and lead.
Yep.
Family nursing.
And what else?
Family nursing.
Yep, good. Great, great. Okay, let me share my screen and we're going to go to, whoops. Oh, actually, hang on one second. Let me see if I have this. See if I have this pulled up. Okay. All righty. Let's go to our module first. Okay, so can you see my screen, guys? Yes. Okay, thank you. So week 2. Is everybody navigating okay through their textbook? Everybody doing okay with there's no issue with the fundamentals, there's no issue. Oh, Jack, the fundamentals book is the correct book. Okay, Elsevier calls it Williamson and your Canvas calls it DeWitt as far as authors, but your fundamentals book is the correct book. Your maternity and peds book, there was never an issue with. And the med surge book, yes, we have different editions, but you have a conversion guide. Okay.
Yeah, so this is the one I don't have the peds book because I haven't taken it yet.
Okay, so you'll need to get
I'm not.
you'll need to get with your campus and get that uploaded into your ebooks. Does everybody know where to find the conversion guide? Or do you need me to show you?
I believe you posted an announcement.
Yeah, if you don't mind showing us though.
Yep. It's in your student resources. Right here, it's the last link. Right here. I'll do a student view so you guys I can see what you see. Whoops. Okay. So this is what you see. Okay, it's right there. Student resources, it's your last link. Okay. Does everybody know how to use the conversion guides? Anybody looked at it?
Yes.
Okay, good. For those of you that haven't, let's pull it up and it's right here. Okay. So there's your editions. 3rd edition, 4th edition. Not a lot has changed. Okay. So there's your conversion guide. Okay. So, all your readings in your PEDS textbook this week should be fine. Okay. Concepts, chapters 11 and 12, growth and family development, infancy through adolescence, and then adulthood and the family, chapter 12. We only have 1 page in your med-surg book, 1024. And then we have two topic sheets. We have school nurse and lead exposure, which I'm going to go through now, and then we'll go to our week 2 notes. One thing I want to mention though is you should all have this handy. Everybody know what this is? Sent it to you in week 1. Anybody tell me what this is for?
Tessie?
Right. Did you guys recognize this? I sent it to you, correct? I gotta have some answers here, guys. I don't know. You got it. People have got it?
Yes.
Okay. Can you guys tell me what it's for? What are we supposed to be doing with it weekly or every couple of weeks?
Filling in the information for the HESI.
Okay, these are all topics that after reviewing previous PNR HESIs, these are the topics that come up. Okay, so you need to be going through these every week or every couple of weeks if you want to be trying to stay ahead of studying for your HESI. And, you know, like I told the other groups this week, even if you want to put in the box to the right, you know, what chapter it was in, what week we discussed it in, just so you have a little bit of an idea of when that was covered. Okay. So the information we're going to cover this week is down towards the bottom, just so you know. We already went and found it. Okay, right in here. Family health, school-age child, adolescents, okay? So anyway, we got that. There's our notes. We're going to cover that, but I do want to go back to the school nurse and lead exposure. Okay, so anybody have any questions? This is a brief overview of school nursing. We'll get to it more in the notes, but what do you guys know about school nursing? What do you think school nurses do? Anybody had any contact with a school nurse through your job, through your kids? What's a school nurse?
When I was in school, they did hearing tests.
Okay, what else do we know about school
And-
nursing?
To handle
Administer
any
medication.
kids that come to them with ailments.
What's the responsibility of the school nurse?
Providing
lots of- Go ahead.
health services. So like helping them find
Yep.
appropriate
sure
health care.
Vaccinated and you keep up to date, probably some of the notices. Like, cause my kid is turning a senior this year and he has like a senior vaccination. So they probably keep up to make sure maybe the kids are vaccinated or they have their exemption forms or they treat for headaches. And they do a number of things.
They help stop the spread of illness.
Great. Think they do a lot of education?
Yeah.
Who do they do
Yeah.
education? Who do they do education with and what do they do?
Like educating the staff, the students, parents, on like different type of like prevention strategies, stuff like that.
Yep, and we have all different age groups. We could be educating preschoolers on hand washing and high schoolers on drug prevention. Right, middle schoolers on safe sex. School nurses do a lot. I remember when I went to school years and years ago, school nurses, you went to the nurse to like get a hug, right? When you were sad, or an ice pack or a Band-Aid. It's not like that anymore. I can tell you I retired from school nursing about a year ago, and we were doing trach care, we were doing suctioning, we were doing catheterizations, we were doing G-tube feedings, G-button replacements, diabetic care, giving insulin, giving glucagon for diabetic emergency, giving EpiPens, inhalers, medications. And then the last couple of years, we kind of became COVID nurses on top of all that. Okay, so lots and lots of things the school nurse does now. Okay, We know in the United States, more than 40% of school-age kids have at least one chronic health condition. Right? That could be asthma, allergies, seizures, diabetes, or oral health. Okay. A lot of times in some of the real poverty-stricken areas, the school nurses are often the only health visit, or the only health person that these kids see. Right? So school nurses play a huge role in daily management. Our job is to keep the kids safe. And for those that help us in the clinic, our job is to train and educate them to be able to safely care for these students as well. Okay, so we may be delegating certain tasks. It depends on your state and what your scope of practice and your delegation guidelines are. Okay, so we help families in many, 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 many ways. We help them both during the school day, bell to bell, and we're also working with them outside the school day. The school nurses participate in special ed. They're part of the special ed team. They work with physical therapy and occupational therapy and speech therapy, right? They're part of that team that provides services to our in-need children. Okay. We do health histories. For all of our special education students, but we do health inventories on all the kids in the building every year. It's our job, school nurse's job, to know what's going on in your building. Your administrators need to know that. Your teachers need to know what kids are in the school that have allergies, asthma, whatever health conditions they might have. And then more importantly, who has an inhaler, who has an EpiPen. Not all kids with asthma need inhalers in the school. Not all kids with allergies need an EpiPen in the school. But it's critical for the teachers and the paraprofessionals, or whatever you call them in your schools, to know what's in the building. School nurses also help families with access to insurance. A lot of families don't have insurance. There's a lot of state-funded programs that families can qualify for, and the school nurse helps out with that. I always did an inventory at the beginning of the year of, pardon me, on their registration, parents had to fill out if they had insurance or not. They didn't. I did a referral over to our Medicaid office. Okay, and we work to get them low-cost health insurance. Okay, we talk to doctors all the time, especially with our more challenging kids, clarifying doctor's orders, trying to get doctor's orders, trying to get insulin orders, trying to get cath orders. There's nothing we can't do anything without an order. Give medication, take care of diabetic students, give any kind of medication, routine or emergency, or do any kind of nursing procedure, any procedure, without a doctor's order. So we have to obtain that. And with our more complicated kids, we speak with doctors frequently. We work with kids that have toileting issues, all the way up through middle school. Okay, we consider potty training at age 5 should be in place, and after that, we start working on the families of with suggestions, interventions, services they might need. We should be a wealth of knowledge for all the services in the community that any family may need. Homelessness is huge. Okay, what services do our homeless families need? Do they need food banks? Do they need clothes? Kind of when we fell into the role of COVID nurse the last 2 years, the school nurses' role was elevated significantly. Everybody came to the school nurse for everything. so-and-so's coughing, so-and-so has a temperature, what do we do? So it's been a busy couple of years for school nurses. We kind of became overnight public health nurses with this COVID pandemic, but I certainly learned a lot. And like I said, the benefits of school nurses reach way beyond the school walls. And here's an interesting statistic. School nurses make a big difference financially. Okay, we can save states, federal government money. Research shows that for every $1 spent on school nursing, you can save $2.20 from costly emergency room visits. We're able to intervene during the school day and maybe head off an emergency room visit after school, right? Come get your kid. Looks like they might have conjunctivitis and take him to the doctor versus showing up at the ER after school. Okay, and I'm just going to continue on this first part of school nursing because it's in your notes. So let's just keep going with school nursing. So what kind of roles does a school nurse play? Or what kind of hats might she wear? I wore all these hats, right? I was a direct caregiver. I was doing the cathing, giving the insulin, doing the trach suctioning, administering emergency medications, right? Caring for concussions and falls and 911. And so direct caregiver, right? Overseeing medication in schools. Okay, overseeing self-administration. We usually don't do that in preschool and elementary school. We usually keep all the meds locked up, but usually in middle school and high school, they're doing self-administering. They're self-administering their inhaler or their oral meds if they need it. And then certainly a big role is health educator. Right, one of the things that we need to do inventories on are developmental milestones for our special ed kids, because one of the requirements of special ed is that there's a full health assessment completed. Okay, and that's information from birth all the way up to however old they are when they're trying to qualify. Growth and development, did they meet their milestones? Puberty, do they have any? We may be educating about substance abuse prevention, hand hygiene, illness prevention, diet, exercise, obesity prevention. Educate about everything. My preschoolers, we educate in kindergartens, we kind of did hand washing and safety. And the rest of middle school, we were talking about safety and bullying and harassing and healthy diet. And by the time we got up to middle school, we were talking practicing safe sex, obesity prevention, drug prevention. In high school, all of that, plus depression, suicide, anxiety, coping mechanisms. So when you're teaching from 3 to 18 or 19, you have to know who your audience is and obviously tailor your teaching to that group. Okay, so that's our health educator role. Consultant, we talked a little bit about this, providing health information to teachers, school administrators, parents. Everybody in the building needs to know what's going on. You know, teachers cross cover for each other. Paras cover up, whatever you want to call them. Aides cover out in the playground, in the cafeteria. And then case manager. Case manager is, we'll talk about that later in the term, but case manager simply means managing kids with chronic illness, coordinating care. The nurse we became instant case managers overnight with COVID. Okay. So kids with complex chronic illnesses outside of COVID, we have to manage that. What is the schedule during the day? You know, when's PT? We have to work, you know, if it's a student that needs to be capped or a student that needs a G-tube feeding, how do we work around PT and OT and speech? How do we work around the services they get at school? Okay. And then community outreach, we participate in health fairs or festivals. we volunteer, we did COVID vaccination clinics, we do flu clinics. So we do lots of things outside in the community as well. And so let's talk about prevention levels. I know this is for school, but for school nurse, but let's talk about it. Tell me, what is primary, secondary, and tertiary? We have to have an understanding of that early in this term. What's primary?
Prevention.
Prevention from what?
So like preventing a health problem before it occurs. So
Thank you. Okay.
in the safety notes, it says like for childhood injuries, making sure they wear a seatbelt to kind of avoid those injuries that they could.
So primary prevention is preventing a problem before it occurs, right? So what are some examples of primary prevention? All right, well, we want to provide education and prevention, or provide education on prevention of childhood injuries. So like you just said, seatbelts, education for seatbelts, education for helmets, playground safety. And that includes assessing playgrounds for safety. Let's say you're the community nurse, and the community is building a new playground. They just got a grant for a new playground, and they tap into you and say, hey, we're building a new playground. We need your feedback. Guys need to be able to know what playground safety looks like. I know it sounds kind of trivial, but you're part of that team that is developing the new playground. So kinds of equipments are safe, what's not safe, what kinds of pavement, gravel, what does playground safety look like? So that's something you would need to know. And then prevention of sports related injuries. You know, we're working with trainers and athletic directors and parents and coaches. And the one that comes to mind is concussion. You know, concussion is very prevalent, obviously, in sports these days. And how can we do some education with parents and trainers about how to recognize a concussion? What do you do? So preventing a problem before it ever occurs. Okay. And then primary for schools also includes prevention of substance abuse behaviors. It is a well-known fact that providing education early on of the effects of substance abuse can have a dramatic impact on the student's use of drugs. The earlier, the better. Okay. Provide education on appropriate coping mechanisms to reduce risk. Really important, right? So we're wearing our mental health hat. Okay, in community nursing, probably said this last week, you are bringing all your tools in your toolbox, right? You're bringing mental health, maternity, peds. Okay. And then also it's important for education. We're still in primary, so it's important to improve our awareness for teachers and parents and the community on substance abuse facts. What are the current trends? What are the dangers? You know, see something, say something. And then you could have education nights for parents about substance abuse. How to recognize if your kid's using drugs, how to recognize if your kid's being bullied, how to recognize if your child is depressed or maybe suicidal. Okay, and then how do we reduce the risk of disease? Okay, well, it's a well-known fact that immunizations are the leading solution to preventing childhood illnesses. Okay. In this country, we have a no shots, no school law. It's a federal law. Okay. However, all states implement it differently. For example, parents are allowed to complete exemptions. Okay. So states allow medical exemptions from vaccines in 48 states. Okay. the 47 states. They also allow for religious and personal. Okay, so medical is the student is not, the client is not healthy enough to have vaccines. Religious, there's some kind of religious conflict. And then personal is just philosophical. Okay, yes, would we like 100% of kids to be immunized going to school? Of course. But you have a 7, 8%, 9% exemption rate. As long as the parents complete the appropriate paperwork in these 47 states. Okay, the one thing we have to remember, excuse me. The one thing we have to remember is we can't be judgmental. If a parent chooses to not immunize, okay, we need to respect that. Okay. So what I would do is present, like this says, evidence-based education, okay, of why immunizations are so important, right? We can't be coercing or shaming them. One of the things that school nurses need to be mindful of is who's not immunized in your building. Because if you have an outbreak of a communicable disease, say, for example, pertussis, right? Those kids are going to be at very high risk, right? Not immunized. So we would have kind of a first call list. And we would call the parents of, number one, the kids that were not immunized against pertussis, and the immunocompromised kids, such as kids in cancer treatment or kids with some kind of immunocompromised condition, or lack of immunization. We would call those parents and say, here's what's going on. You might want to keep your kid out of school till this passes. Okay. The other ways we reduce risk of disease is flu shot, encouraging flu shots. Okay. We'll have a couple of flu shot, some schools, we did flu shot clinics. In the community, there's flu shot clinics all over. And still primary diet, exercise, lifestyle risks to avoid chronic illnesses down the road. There's not enough education that can be done with these kids. Okay, and then Healthy People 2030 objective is to reduce the number of schools selling junk food. That's good. Okay. And then when you can do it, sex education for the prevention of STDs and unintended pregnancies. That's also a Healthy People 2030 objective. So you need to check with your district to see if you could be doing that. But that's another primary prevention. And then this is interesting. If directly questioned by a student, they have to come to you first. Can't go to them. If directly a student approaches you, you can discuss contraception, emergency contraception. Okay. Children and adolescents have reproductive rights. Believe it or not, parental consent is not required in response to direct questions or requests, but the student has to approach you. Okay. We talked about this briefly. When providing education, always keep the student's developmental stage in mind. The younger the child, the shorter the education should be. Use lots of pictures, examples, consider toys, stuffed animals for young kids. So have any of you had any experience with any of this we just talked about? Primary prevention? Have you done any of this? Thought about it? Experienced it with your own kids in school, if you have kids?
I don't have any kids, but I work with kids, and so we
Oh,
talk about
okay.
a lot of like prevention methods with their
Okay.
parents. So we like work with a lot of kids on the autism spectrum.
Okay,
So just kind of like giving like social stories of how to be safe
yeah,
in different like areas at school.
great. So is this making sense to you?
Yes.
Okay, great. Secondary, let's talk about secondary with school nurses. Screening for early identification and early treatment of a condition. So kids will come to the clinic, right? Headaches, stomach aches, fever, sore throat, cuts, bruises, sprains, whatever, anxiety. Okay. Children are much more likely to have somatic complaints versus psychological issues. Okay. But what we had to remember is chronic or frequent headaches may require some investigation, whether they, what if there's something else going on. And I have an example from a couple of years ago. There was and I work in a district that had AIDS in the clinic. Okay. And then we oversaw that. So I finally got a call after the first week that this one particular, I think she was a 5th grader. She was coming to the clinic between 4th and 5th period every day for like a week. Same time. So as we discussed this, I said, we need to look into this further. You're sure she doesn't have a stomach ache? You're sure she doesn't have a headache? Nope, she's been at the same time every day. She's fine. I called mom. Mom said there's no issues going on at home and da 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 da. So as we did our little investigation, it turns out that she didn't want to go to 5th period because she was being bullied and harassed by a large group of girls. And it turns out it was way more than that between the home life and school life. But my point is, you have to be, if you're ruling out stomach aches and headaches, you need to be willing to take that next step and figure out what's going on. Because that's pretty common in schools these days, is the bullying and the harassing, right? Is there something else going on? Anxiety, depression, suicidal thoughts? Is there sex abuse going on? Physical, emotional abuse at home? Okay. So at school, it was bullying, but there turned out to be a whole set of issues at home. Okay. So the other thing we do is screen for potentially contagious disease. Okay. So we can be asked to screen for lice, conjunctivitis, chickenpox, flu, COVID, TB. Okay. So we're always screening for those. Right. And then we're also screening for the presence of chronic illnesses, obesity. Anybody know what acanthosis is? Anybody read up on that? What is it associated with? Diabetes, type 1 diabetes. Anybody know what it is? It's the discoloration in your skin folds. Okay. So we're screening for that. We're screening for asthma, allergies, anxiety, depression, ADHD, bipolar. Okay, and I just told you what that is. What does it signify? Possibly type 1 diabetes. What we do, refer them to their physician. Okay, next is screening for child abuse and neglect. Right? We all know that all of us are mandatory reporters of child abuse, right? We all know that?
Yeah.
And is that just at work? Or is that anywhere?
No.
Anywhere.
Grocery store? Yeah. Okay, we're mandatory reporters. Okay, we'll talk a little bit more of that in the violence and abuse chapter. Right, and we also know that the presence of abuse and neglect greatly increase the future risk for mental health disorders, suicide, substance abuse, maybe unintended pregnancies, and certainly the increase in STDs. Other screenings school nurses do are vision and hearing screenings. Always good to identify these younger kids that have hearing or vision issues. They're screened they're screened annually. Okay, and that's where you pick up on these early kids. A teacher might say, hey, could you, screen Susie? She's squinting when she looks at the board. She's not able to do this. Sure. That's why we do those screenings, scoliosis screenings if necessary. And then the last bullet we've touched upon, identify bullying to identify risk for mental health disorders, suicide, and violence toward others. Bullying, we know, is at the center of most school violence, right? Screening for these behaviors and intervening early can possibly help prevent violence to oneself or others. And this is so true. And I saw it over the development of 2 years of COVID. Kids need mental health services as early as possible once they're identified to have some red flags, right? They need those mental health services to improve their coping, improve their emotional and mental health development, and to hopefully prevent any long-term consequences. Critical. What have we seen? What happened? What happened with COVID with kids? They were isolated. They were decreased social interactions. What happened? What are we seeing now? What effects are we seeing of that now?
A lot of kids have like environmental autism. And so it's just like where they have social deficits because of the lack of social interactions they've had.
Yep. Excellent. Yeah, absolutely. And we're seeing it at a much younger age over the last 2 years. My daughter-in-law is a first grade teacher, and her class this past fall were first graders that had never been into the school building before because they missed their whole year of kindergarten, right? So she said she had kids coming in that were first grade and had never been into the school before. So it was really challenging to acclimate these kids. Okay, and then tertiary. Tertiary is treatment, managing an existing condition. So they need to have something going on for it to be considered tertiary. For example, let's say a kid has asthma or allergies, and you're giving medication for an already existing condition. Okay, we talked about case management, participating in IEPs. So IEPs are your individual education plans, which are part of special ed. Okay, so the student already has some issues that have been identified that they need services for. So it's already an existing condition, which is why school nurses participating in individual education plans is tertiary. And then tertiary also includes teaching students and parents and teachers how to manage chronic illnesses. We do a lot of that. Sometimes we're the ones who teach the kids how to use their inhalers. They come in not knowing, kind of just popping it around, and we teach them how to use it. We're involved in all new diabetic cases. We help teach them how to check their blood sugars, work their pumps, give their insulin shots. Okay, so lots of education and actually hands-on with our diabetic students. And then working with pregnant adolescents to maintain healthy pregnancies and healthy school environment. Okay, we want to make sure that these young ladies are getting to their prenatal appointments, that they're taking their vitamins, that they're, if they're having issues, that somebody can be attentive to that. Okay. So that's it for school nursing. Any questions? School nurses rock. Sorry, they do. I love being a school nurse. Loved it. Anybody have any interest in going into school nursing? It's awesome. Okay, let's talk about family development. Simple question. What is a family? Read the next sentence. Whatever you say it is. That's your family, right? Family is the people who provide physical, emotional, and financial support. Non-traditional families are the norm now. Okay. And then one of the things we talk about with families is a functional family versus a dysfunctional family. You'll also see it as healthy family, unhealthy family. They mean the same. But there's 5 functions of a family. And here's the 5. Okay, and these are the examples they give are focused on a healthy functioning family. So if it's a dysfunctional family, we just think the opposite. For example, financial. Okay, these are your 5 functions: financial, health, reproductive, socialization, and affective. So financial, healthy families planning for the future, making good financial decisions, providing housing and insurance. So what would a dysfunctional family? Not planning for the future, not making good financial decisions, not able to provide housing and insurance. Okay, health. Healthy functioning of a family teaches healthy behaviors, teaches health maintenance, provides informal caregiving. So a dysfunctional family would be the opposite. Then you have your reproductive function, your socialization, your affective. Okay, affective, creating a sense of identity and belonging through affection, love, time together, bonding. So dysfunctional would be not creating a sense of identity and belonging. Okay, so failure to meet these functions leads to dysfunction, strife, and crises. A strong contributing factor to future substance abuse, anxiety, depression, work absenteeism, unsafe sex is a dysfunctional family setting. Right? Family is our first and most important safety net and social support system. It's one of our primary coping mechanisms. Without it, tendency toward maladaptive coping mechanisms arise. Okay, in families, for purposes of this, families' problems can be predicted through a family life cycle theory. Okay, so that's what this highlighted box is. This theory evaluates developmental stages of children and the response by parents. Really interesting. We need to know this. You guys need to know this. Right? So in development, failure to achieve a task restricts development towards the next. Right? Kids don't develop in a vacuum. They develop in a direct relation with parental response to the changes they undergo. Okay, so traditional family life cycle stages and family developmental tasks. Okay, and you can read through these. Married couple, establish a relationship as a family unit. Okay, and childbearing families with infants. Then we go through all the stages and what's going on at that time. Adjust to pregnancy, and then after birth, learn new roles as mom and dad. Then you get to preschool. Okay, this is a family life cycle. What's going on in preschool? Understanding growth and development, including discipline, coping with your own energy depletion, right? Arrange for individual time, family time, couple time. Families with school-age children. Again, this is what's going on. Okay, families with adolescents. I like this one. Adapting to changes in communication, power structure, decision-making, as teens increase their autonomy. Okay, any questions about that? And then family health risks. Okay, we look at it from 3 areas: genetics, environment, and behavioral. Okay. Disease develops in response to 3 contributing factors. What's your generic risk? What's your environmental risk? And what's your lifestyle risk, behavioral risk? Okay, and so when we're assessing and caring for families, we have to consider all 3. Okay, with genetics, some of us are born with certain predispositions. Maybe a family with cardiac disease, maybe a family with cancer, maybe generations of substance abuse. Okay, but interestingly enough, the majority of these diseases is not caused directly by genetics. Okay, most of the diseases developed are due to environmental and behavioral exposures. But family health histories help identify genetic risks. And that's that genome that you're going to read about in your readings. Genogram is we go back 3 generations and do a family history. Okay, so we find out what your uncles died from, what your aunts died from, what your grandparents died from, and see if you have a certain predisposition. Okay, what kinds of risks are environmental risks? Physical environment, social environment, political environment. What if you're a community nurse in a high crime neighborhood?
You have gang related issues, just
Totally.
issues, different races have different communities and upbringing and how we, navigate our lives. But the environmental issues plays a lot in it.
A lot. Environments that have high pollution, maybe close living quarters, high stress environments. What about the environment where there's discrimination based on race, social status, religion, even immigration status? What if it's a community that has lack of adequate financial resources, high unemployment, lacks social resources, gyms, playgrounds, emotional resources, all this leads.
Fresh fruit and vegetables.
What? Say
Some of the environment is like a lot of people don't have access to like grocery stores, like good,
Right.
like fresh vegetables and fruits and stuff like that.
Yeah, exactly. Right, all of these lead to higher risk. Okay, and eventually, if not resolved, will lead to crisis. And then what are some behavioral things we need to look at? Diet. Right? We know our American diet, standard American diet is high in sodium, high in saturated fats, sugar, right? And this contributes to huge increase in chronic inflammatory conditions. Diabetes, hypertension, CHF, osteoporosis, right? We know the diet itself is influenced by environmental and socioeconomics, right? Obviously, the best case scenario is fruits and veggies and whole grains and seafood, right? Physical activity. That's why we do so much education in the community about lifestyle choices. And then parents, obviously, families play a very important role in modeling healthy eating. Maybe, if your parents eat fruits and vegetables and that's what you're feeding your kids, and hopefully that's going to be what they continue with. Right? So kids growing up seeing these kinds of behaviors will hopefully engage in them as they get older. And then the other behavioral issues, limiting alcohol, of trying to avoid tobacco, avoiding illegal drugs, right? And all that contributes to more positive health if you're not doing that. Violence and abuse is a strong risk factor for future violence and abuse, for substance abuse, for mental health issues. Okay, violence is a huge red flag. Okay, that's just a little visual about childhood obesity is one of the biggest risks in our kids right now. So rates of obesity in children have been rising steadily. Okay, why? Not just diet and exercise, but also environmental exposures to chemicals and pollution. Right? And we know that the consequences of childhood obesity are vast and they're lifelong. Right? These kids are at risk down the road for cardiovascular, respiratory, all your systems, renal, menstrual, metabolic, bone and joint, and especially psych issues. And I saw this all the time in the schools, that obesity in children it certainly increases the risk of bullying and harassment, without a doubt. The other thing that's on the rise is type 2 diabetes. Okay. Type 2 diabetes is your diet diabetes, I call it. Right? Rates are much higher in ethnic minorities, including the Hispanic, African American, and American Indian populations. Okay. And there's the definite dark patches, the skin folds that do not itch or burn. That's the acanthosis. Okay. And then the other part of behavioral assessment is your injuries and accidents, or common causes of preventable injuries and death in kids. Okay. Preventable. Falls, fires, drownings, suffocation, poisonings, sports accidents, RV accidents. Okay. And then the last part of the behavioral is exposure to secondhand smoke, what the risks of that are. Right? If babies are going to be at increased for SIDS when a mother smokes during her pregnancy. Right? They're going to have an increased rates of ear infections, respiratory infections, asthma, long-term risk for cancers, lung disease, just like the smoker, and much higher risk of a child that smokes. Right, so parents need a lot of education on the effects of cigarette smoke on children, right, and the way they're role modeling their behavior. Make sense? All right, let's cover these common childhood ailments. Has anybody read your Pete's book with any of these? What's asthma? Anybody? What's asthma?
It's a condition that affects your airways, like in the lungs, so making it hard to difficult and carry.
Yep. Okay. Asthma, allergies, there's a strong predisposition to a genetic predisposition to asthma and allergies. Okay. So kids with eczema in infancy are at much higher risk. Okay. Increased risk in obesity. Right. These are all kind of predispositions to asthma and allergies. Right. Asthma is the most common chronic illness in kids. That's a fact. What does it cause? Have you ever heard a kid cough that's having an asthma attack? Hey, asthma, recurrent bronchospasms, mucus production, mucosal edema leading to airway restriction. And what triggers asthma? Environmental pollutants, lots of things. What's the most I'm talking about allergies now, but with asthma, triggered by environmental pollutants, and allergens can also be triggered by foods. What's the most common food for allergies?
Peanuts.
Peanuts,
Nuts.
nuts. Okay,
Not and
yep. Seafood's getting pretty big. But nuts, peanuts is pretty common. Okay. Poorly treated asthma in childhood leads to significant lung issues later on in life. Okay. What does an asthma attack sound like? Cough, usually a dry cough, wheezing, difficulty breathing, right? They can inhale, but it's hard for them to exhale. Okay. Exercise intolerance, decreased physical activity, possible signs of air hunger, which is your nasal flaring. Okay. Pulse goes up, respiratory rate goes up. Okay. And then what are your solutions? You have an inhaler. Okay, bronchodilators should be inhaled with slow, deep breath to ensure medication gets deep into the lung. And then hold their breath when they take it in. Okay, lots of times with the kids, spacers are used so they can get that whole dose in there. Okay. So with regards to asthma, environmental control is important. Okay, you try and reduce as much as you can the exposure to allergens and whatever other triggers. I always want to know with my asthma kids in the schools, who has asthma and what are their triggers? And do they need an inhaler? Okay. How do we reduce the exposure? Well, we know that stuffed animals and carpets are particularly undesirable. Allergens can be on pillows and mattresses, avoiding cigarette smoke. HEPA filters in the child's bedroom or the entire house. And then also a diet with anti-inflammatory diet, fruits, veggies, whole grains, seafoods. Always try and maintain excellent intake of oral fluids, especially for the asthmatics, and make them walk around with a water bottle all day. And then importantly is exercise. Exercise is important and shouldn't be avoided. However, some types of activities are easier to tolerate with kids with asthma. Swimming, maybe short bursts of intense activity, baseball, basketball, right? However, you don't want these kids running marathons, right? Not gonna be able to tolerate it. Okay, so that's asthma. What about eczema?
skin condition.
Yeah, eczema is like a dermatitis of the skin from irritants.
Yep. And eczema is actually commonly associated with asthma and allergies. Did you guys know that?
Yeah, my eczema is from allergies, and so is my asthma.
I have allergies and eczema, but the eczema didn't come out until like I started washing my hands more. So it kind of brought it out.
Yeah, one of my kids, some of my kids have asthma, and one of them always gets a rash in the same place. Like when he's about to have an asthma attack, which hasn't happened in years, but it was like a warning sign. The rash. Yep. So with eczema, you got to be careful about the scratching, right? Because what is scratching going to lead to? Open
skin.
Open skin, and what's that going to breed? Infection.
Bacteria can lead to infection.
Bacteria, absolutely. Right? Sometimes allergy testing is done if rashes are commonly associated. with asthma and allergies, right? So you go for allergy testing. Okay. So the immune system reacts to orally consume foods, inhaled allergens, pollutants, topical exposures, soaps, fabrics, insect bites. Talked about allergy testing. And then how is it treated? Mostly treated via control of itching, inflammation, and dryness. So you have your oatmeal baths, your topical ointments, non-steroidal ointments.
I do antihistamines and I get allergy injections.
Okay. Okay. And you know, the other thing with asthma and allergies is you should know if family members or close friends or coworkers have EpiPens. I mean, they don't have to tell you, but you know, does anybody have severe allergic reaction that you work with that has an EpiPen in their purse? Excuse me, or in their car?
My son's stepmom does, and she like just recently became allergic to like peanuts, tree nuts, like even strawberries.
Yeah. Yep. So important to know. Okay, type 1 diabetes. What do we know about type 1 diabetes? Pretty darn common in the schools. We had 85,000 students and we had 900 kids who were diabetic. Okay, all ranging all the way from 3 to high school. Right, well, we know about type 1 diabetes. You guys know the difference between type 1 and type 2? What's the difference?
One is insulin dependent, one is non.
Diet. Type 1 diabetes, the autoimmune destruction of the pancreatic beta cells leading to insulin deficiency. Basically, your pancreas doesn't produce enough insulin. Okay. How do you recognize somebody that might have some red flags? Okay, maybe an acute onset.
Like jittery or headedness.
Lethargy,
Confusion.
weakness. What else?
Confusion.
Yep. Difficulty speaking.
Clammy skin, possibly.
Yep. So basically, sugar cannot enter the cells without the influence of insulin. Okay. So as insulin levels fall, blood glucose, blood sugars rise. Okay. And driving all those symptoms, right? And the cell starts to burn fat and protein for energy. Okay, that can lead to weight loss and acidosis. Weight loss is kind of at least for the kids I saw in school, weight loss is kind of a red flag. Okay, there's sometimes a history of recurrent infections, right? An acute infection can trigger your diabetic ketoacidosis. What's that? Is your blood sugar too high or too low?
Too high.
It's an emergency situation. So treatment is insulin replacement and careful patient family teaching to control glucose through insulin, diet, and exercise. Okay, so insulin, you can do insulin in a vial with a syringe, draw it up. They now have insulin pens that you can dial in the dose, right? And pumps are
Got the
all
ones that the pumps, don't they?
Yep,
That
and
like
then
administer.
pumps that administer your dose for you. Last year, I had 3 preschoolers aged, one was 3, 2 or 4 on pumps. So it's getting, obviously you have to lock their settings because you have to manage their care, but yeah, pumps are becoming real popular. They have been, but they're And there's so many different kinds. So, yeah. And then lots of education with a new diabetic client, whether they're a kid, an adult, elderly, lots of teaching. Okay. And so with kids, growth spurts are common in children that can cause variations of insulin needs. Psychosocial complications are common. Yeah, when these kids, the younger they're diagnosed, the harder it is, right? Because they think they're different. You know, why do they have to keep leaving the classroom to go get their blood sugar checked? You know, so it's a very difficult disease for kids and adolescents. They experience grief, sadness, anger. They may resent their parents and healthcare providers for the restrictions. That happens when they get older. Okay, the more independent they get, they just blow it off. A lot of kids just blow it off, checking their blood sugars, you know, go back to eating junk food. So it's hard, right? It's important to let kids express their grief and anger and teach them how to cope with these emotions and the illness to increase the likelihood of normal behavioral development over time. Honestly, I find that the parents have a more difficult time than the kid. Parents are just absolutely beside themselves. It takes a while to really sit with them and talk with them and educate them that, you know, this is a lifelong issue. It's a lifelong issue. Let's jump on it now and let's get it sorted out so that everybody feels comfortable. But parents have a really hard time with it. Okay. Their lives have changed forever. And we should be sensitive to that. We should be sensitive to the devastation that it brings to them. Right? Support groups. We have a wonderful program. We have a wonderful program in Colorado. It's called the Barbara Davis Center. And it's the Center for Childhood Diabetes, where most of our kids in the state go there for care. Just focuses on that. Right? They have lots of support groups with other kids, adolescents that also have type 1 diabetes. Okay. And then any patient with diabetes, we know that skincare and infection prevention is vital. Okay. Conjunctivitis. What's the other word for conjunctivitis?
Pink eye.
Mm-hmm. Conjunctivitis spreads like wildfire. Right? You have got to get these kids or your client, these people have to be isolated and start on some kind of an eye drop treatment. In the schools, they needed that to happen. I mean, we could call a parent in the morning, your kid has pink eye, they could go home, get them starting to treat them, and then bring them back to school in the afternoon. Okay, so what is acute conjunctivitis or pink eye? Inflammation of the conjunctiva. Okay, your mucous membranes, right? Your mucous membranes in your eyelids. It can be bacteria, it can be viral, can be from allergies, from allergens, from irritants or toxins. Right? Bacterial conjunctivitis is more likely to begin in one eye and spread to the other eye within a few days. Right? And that's your pink eye. That's your bacterial. And then viral, allergic, and toxic are more likely to start in both eyes together. Right? Bacterial conjunctivitis is infectious. It spreads. Okay, so the teaching includes hand washing, trying to avoid rubbing your eyes, and then treatment with antibiotics. Okay. Able to return to school 24 hours after antibiotic drops have started. Well, our district kind of said, let's take them home and get them treated and they come back to school. Okay, scabies. You know what scabies are? Parasite. Let's be a parasite. Burrows under the skin and lays eggs. Causes intense itching, especially at night. Right? The rashes, this, I can't pronounce, vesicular with excoriation marks and burrows. You can see lines under the skin. Scabies most likely is located in your skin folds, soles of your feet, between your fingers and toes. And how does it spread? By direct contact, person to person, or indirect contact by sharing a bed or clothing. And what is it treated with? It's treated with an anti-parasitical cream and sometimes evermycin. You got to be careful. It requires a lot of education. The families need to know that the clothing, the bedding, everything needs to be washed, everything, and dried with high heat. Non-washable items can be bagged up for at least a week, because typically the mites die within a couple of days. Okay. Pediculosis, capitis. What's that a fancy word for? Lice.
Lice.
Yep, lice. Okay, head lice. Okay. You find live lice, you find louse nits near the base of the hair shaft. Okay. Right, nits, you can see nits in adult lice. Anybody done any lice screenings? Anybody see what lice looks like?
My daughter had it last year. Oh, and it was horrible because she's got thick, long hair and it's like a blondish brown color. Oh, it was,
Oh, what a nightmare.
yes, it was a nightmare. I felt like it took forever for us to get rid of it because she's only 4, you know, so it was difficult to even get her to sit still.
Lice is a difficult one. You know, people think of lice as like, ew, gross, you know, your family's dirty, or it's not that. Okay.
No.
It's easily transmitted to others. Combs, hats, hairbrushes, person-to-person contact, schools, daycare settings. And then it's completely unrelated to cleanliness. Completely. It's very common in daycare and school settings. It's treated topically, usually 1 week apart, 2 treatments. Treatment on the day you find the live lice, and then treatment 7 days later. Okay, and then you have to get rid of the nits. Okay, you got to comb and brush and brush. Right, so we try and send kids home from school discreetly until treatment's been initiated. And each district has their own lice policy as far as if one student comes up with live lice, how many more students do you have to check? We needed 3 students with live lice in the same classroom to check the whole classroom. But there's a lot of people still.
I know they sent a note home with us as far as, and they even like put her hair up for her and everything.
Yeah. But it's something you have to let other families know about. You know, you don't let them know who the infected student is, but you do need to let them know. And then the next, is this the last one? No, ADHD. ADHD, inattention, distractibility, increased gross motor activity, impulsivity, right? And it's usually associated with underperformance in the school setting. It's not related to a learning disability. Their underperformance is due to their symptoms, their inability to focus.
I feel like if anything, most kids that have ADHD are very smart.
They may have low self-esteem, poor interaction with others. Okay, treat with oral medications, coping skills, environmental adjustments, That's all a conversation with you and your physician. Or with them, the parents and their physician. Yeah. The teachers in the schools are supposed to let the parents handle it with their doctors. Supposed to. Yeah. Some things that might help: place a student in front of the classroom, give clear, short directions. Okay, rather than several steps at once. Repeat. Provide rest breaks. Right? Don't limit outdoor physical activity as a punishment. They need this activity. Then maybe, maybe I have ADHD kids that are qualified for special ed, that need some services, right? So extra help, tutoring may be helpful to these kids. Maybe some behavioral counseling and training with maybe your school social worker or school psychologist. There's lead exposure. Okay. Iron deficiency anemia. Okay. Is more likely in infancy and adolescence due to your growth spurts. Right. It also could be related to iron deficiency in mom during pregnancy. Okay. Infants rely on stores developed during the prenatal, stores of iron. They're developed during prenatal development as they begin eating. Right? Relying too heavily on bottle feeding to avoid battles at meals with older infants can lead to iron deficiency. What are some high iron foods? Liver, red meat, egg, yolk, dark greens, leafy veggies, dried fruit, dried beans, red cereals. Vitamin C. Did you know that vitamin C improves iron absorption? So incorporating vitamin C containing fruits and veggies with meals can help. Right? Long-standing or undiagnosed iron deficiency anemia and retard growth and cognitive development. We need to be very mindful of that when working with new parents. Okay. Scoliosis. What's scoliosis? I take the essence scoliosis and do the shape curvature of the spine. Right? Symptoms develop slowly and are not typically painful. One shoulder is higher than the other, one scapula is more prominent. Your arm to body space may be unequal. Maybe one arm might seem longer than the other.
Is that
Right,
the
when
one where they're
bending
saying
forward.
high school kids are getting it from their backpacks?
Oh, I haven't
Possibly.
heard that. Haven't
From
heard that.
having heavy backpacks or something and just carrying it on one shoulder.
Huh. Possibly, yeah. Screening should be done before middle school. All right. You observe the back, shoulders, arms, hips while the child stands in front of the nurse and bends over. Okay, scoliosis screening is pretty easy. Okay, and then the last topic is lead exposure. And go back to your module. It's your second content sheet to get a little bit more information. We're going to cover it here, but also it's your second content sheet. So we did the school nurse one. You guys know what I'm talking about, right? It's the page after your reading assignment. You're reading, first page after that is school nursing. Second page is lead exposure. So it's just additional information from this. Where does lead come from? Paint chips, right? It can also come from the soil, but paint chips. Okay, so paint chips. So exposure to lead can be really very unhealthy for kids. So I always think of older houses or older schools. Okay, so as paint chips away, it can be inhaled orally inhaled or orally consumed by the exposed. You ever see toddlers walking along windowsills putting chipped paint in their mouth? That's what that is. Right? It may also still be present in the soil. Okay, so prior to 1978, there really wasn't a lot of regulations. Now there's a lot of regulations, you know, with new homes and new structures. Right? Lead's also in the plumbing materials that were used. So anybody with old plumbing, right? The good news is lead levels in Americans have been declining for years. Okay, we used to test the lead levels in kids, right? Now we just screen with a questionnaire and do blood testing if the screening indicates a high risk. Okay, and high lead levels in kids could be associated with developmental cognitive delays. May also be associated with inattentiveness, distractibility, hyperactivity, right? So again, it's very similar to ADHD, so you have to be careful in your assessment, right? So higher levels of lead are also associated with headaches and abdominal pain, constipation, clumsiness, agitation. Okay, what's the treatment? Remove the exposure, right? Children should not be present when pain is removed through sanding. Okay. So lead poisoning is something to be very mindful with kids. Okay. So going through these notes, the nice thing is that we've kind of just done it. We've done a summary for you of all the reading, you know, but it doesn't excuse you guys for not going back and doing the readings. I just like to go over the summary of what's going to be in your reading, but I really want you to do that reading to get some additional knowledge. Okay. So does anybody have any questions? Is that helpful? Too much information? What are you thinking? Okay, let's everybody pull up their week 2 attestation, please. If you're on your computer. And don't forget you have a quiz this week. Okay, preferably, I know you guys are a Friday night class, but preferably you should do it after class because it covers what we cover in class. But some of you have already done it. And that's great. But the quizzes are designed to be taken after you go to class. So just Professor Marvel, what's the date today? 31, no, 22nd. So Professor Marvel, 7/22. And I just want to make sure that a few people didn't slip in. Whitney, did Whitney get in or did Rachel get in? iPhone, whose iPhone? That gentleman with the white t-shirt. Is that, yeah, that's what's your first?
Jason.
Jason, yeah. I asked you that last week, didn't I? Jason.
Yeah, I put it in the chat box.
I'll remember that next week. So everybody do that and hit submit. I know you guys are exhausted. It's late on a Friday night, so how about if we get done a little bit early? How are you guys with that? Hey, you know what you could do for the next half hour if you wanted to? You pull out your HESI study guide and you could go in there and complete the areas that we covered today. I always like the gift of time, but I always like it to be productive too. Anybody have any questions?
For our exam, Are you gonna do like a review, or should we
Yep.
kind of like study the?
I'm gonna figure out a review, probably do a couple of reviews at the end of next week.
Okay.
Because you're coming up on week 4. Yeah. Yeah, I need to plan that.
Week 3.
What?
The exam is in week 4.
Yeah.
Were you saying that?
Yeah.
Okay.
So I'd like to do a couple of reviews, maybe next weekend. I know you guys work on weekends, so maybe I'll do one Friday, one Saturday, something like that. I think, Dr. Kershaw, who's my teammate, I think she's gone for like 10 days. So I don't think she'll be around to do any reviews. So you're gonna be stuck with me doing the reviews, but I'm hoping to do a couple at the end of next week. I'll try and do one on Friday for those that work on the weekends. Okay, yes, but I promise you I will do an exam review. I just need to and really the review is going to be your notes. Okay, we're going to be reviewing those again, but it's always helpful to go over them. Right?
Will it be recorded?
Oh yeah. We'll record
Okay.
them and send them out. You bet. I'll send them out. And I'll send them out to Dr. Kershaw's classes too. Okay. Questions? Okay. Well, go fill out your HESI study guide and if you want. And we'll see you guys next week. How's that?
Yes, ma'am. Thank you. I hope you have a wonderful
I
weekend.
hope you guys have a really nice weekend and congratulations for making it to the end of week 2.
Thank
Talk
you.
to you
Have a
later.
good night.
Okay. Bye-bye.
Thank you.
You're welcome.
Ms. Marvel,
Yes. You guys
did you
finish
still